In 1616, William Harvey began lecturing at the Royal College of Physicians with a claim that contradicted 2,000 years of medicine. Blood does not ebb and flow like a tide, produced by the liver and consumed by the body. It circulates. The heart pumps it around a closed loop. He was right. The evidence took him 12 more years to compile. Harvey's demonstrations were elegant. Press on a vein and it swells upstream of the obstruction. Blood is moving toward the heart, not away from it. Expose a venous valve and show that blood passes through in only one direction. These were not hypotheses. They were experiments anyone could repeat. Harvey was doing modern experimental physiology in 1620. Harvey's key insight came from comparative anatomy. He examined hearts across many species, fish, frogs, snakes, and mammals. In simpler animals, the heartbeat is slow enough to observe directly. He could watch the heart contract, the blood exit, the valves close. The function of the heart as a pump was visible once you knew how to look. Galen had taught that the liver continuously produced blood from food, which was then distributed to the body and consumed. Harvey calculated that this was impossible. The heart pumps about 60 milliliters per beat, 70 beats per minute, for liters per minute. In 30 minutes, the heart pumps the equivalent of the body's entire blood volume. The liver cannot produce blood that fast. Circulation was the only explanation. The arithmetic was Harvey's masterstroke. He measured the heart's capacity, the pulse rate, and the time. The numbers were undeniable. The heart pumps more blood per hour than exists in the body. That blood must be recirculating. This was not an anatomical argument, it was a mathematical one. Harvey used quantitative reasoning to prove a biological fact. The venous valves were the final piece. Fabricius of Aquapendent, Harvey's teacher in Padua, had described these valves in 1603 but did not understand their function. Harvey demonstrated it. They permit blood to flow only toward the heart, not away from it. Combined with his other observations, the case was complete. Blood circulates. Harvey published De Motu Cordis, on the motion of the heart and blood, in 1628. It is one of the most important books in the history of science. 72 pages. Clear, logical, experimental. It demolished Galen's framework in the most polite and devastating way, by simply showing the evidence, calculation by calculation, experiment by experiment. The reaction was predictable. Older physicians attacked Harvey viciously. His practice declined. Colleagues called him crack-brained. But younger physicians read De Motu Cordis and saw that Harvey was right. Within a generation, circulation was accepted throughout Europe. The speed of Harvey's vindication was unusual in the history of medicine. The evidence was that clear. Harvey served as physician to both James I and Charles I. Through royal patronage he accessed deer in the royal parks, animals with slower heartbeats that were easier to observe. King Charles I personally witnessed Harvey's demonstrations. The monarch was an enthusiastic supporter of the work that overthrew ancient medicine. Harvey knew blood circulated but could not explain how it moved from the arteries to the veins. The vessels were too small to see. In 1661, Marcello Malpighi solved this with the newly invented microscope. He saw capillaries, tiny vessels connecting arteries to veins. Harvey had died 4 years earlier. His theory was now complete. Harvey's circulation opened medicine's next frontier. If blood circulated, could it be replaced? In 1665, Richard Lower performed the first successful blood transfusion between dogs. In 1667, Jean-Baptiste Denis transfused lamb's blood into a human. The patient survived, probably because so little was transferred. The era of transfusion medicine had begun, even if its success was accidental. Every cardiologist, every cardiac surgeon, every nurse monitoring a patient's circulation is working within the framework Harvey established in 1628. His discovery made possible blood pressure measurement, cardiac catheterization, bypass surgery, and the understanding of every cardiovascular disease. The 4-liter per minute pump that Harvey described is the foundation of all modern cardiac medicine. From Harvey's Lumleian lectures in 1616, to the arithmetic that proved circulation, to de motu cordis demolishing Galen, to Malpighi's microscope completing the circuit, to blood transfusion, to cardiac catheterization. Harvey's discovery that blood circulates was the moment physiology became a science. I am Takku. Harvey measured the heartbeat and overturned 2,000 years of medicine with arithmetic alone. Subscribe to Wisdom of Takku, because numbers have always revealed what authority concealed.